This morning, we are staying on top of the latest with the coronavirus pandemic, and we are working together to make sure everybody stays informed. So joining us this morning on the phone is Senator Martha McSally. Senator, I want to thank you for being with us this morning, and I want to get right into the questions here. We know so many families are worried about how this pandemic is impacting their finances. We know we've had some folks laid off already or furloughed. So what are you doing? What is your office doing to try to soften that economic blow for these families?
Well, thanks, Nick. We're hearing from constituents. This is an unprecedented time, and the financial insecurity is significant for many families and workers and seniors and small businesses. What we're working on right now is legislation that would get cash immediately to Americans below a certain income level. Right now it's $75,000 per person, that we'll be able to get it in the mail. So they have a check to be able to cover their basics just to get through these few weeks as we work to flatten the curve together as a society. We're also, our proposals are for small businesses so they can walk into their local bank, not have to wait in line for a government agency. Through a program that already exists, and that local bank can, in a very swift way, get them resources so that they can keep people on payroll, they can keep paying their rent and their mortgage, because when we get on the other side of this, we want employees still connected to employers, and we want small businesses to be able to turn the key and ramp up again when we get back to being able to go to restaurants and traveling and do all these things. So those are two key provisions. We have to act swiftly. We believe in the next week or two is so critical for people to be able to get this financial assistance directly into their hands.
Yeah, and Senator, do we have a timetable for when families can expect those checks?
Well, as fast as the federal government could possibly work is what we're looking at here. So that's why we've got this legislation we're working through to get agreement. We're trying to get it through the Senate in the next few days. Then hopefully the House will pass it, get it to the president, and then the Treasury will start cutting those checks. Our goal is within the next 2 weeks, by the first week of April, and that's, the Treasury is going to have to work overtime, obviously, to be able to provide those as quickly as possible. Also for small businesses, as soon as the authority is there, they can start working with those banks who have trained individuals to fast track those resources, and that'll be money that won't be a loan, but will actually be paid by the taxpayer through the federal government, but you can get it through your local bank.
Okay, you recently spoke to several Arizona tribal leaders as well. We had a number of new cases overnight reported on the Navajo Nation. We know that they also need some medical supplies and some food distributed. So what is your office doing to help them?
Yes, so we're engaging with them. We want to make sure that as the supply chain of key medical supplies is sent out, that it also includes tribal communities. And so we're working with federal agencies related to that. Look, there's shortages of protective equipment for all healthcare workers and some of the swabs and other things. We want to make sure that there's parity with tribal communities so that they get the healthcare resources they need. And we did hear from them about challenges. Some of them have traveling many hours and then going to the stores and not having things on the shelves. So we're, again, working with local communities, trying to see if there's ways. Some of them are accommodating certain times for elderly to make sure that, our tribal leaders and their community can also get access to food that they need to get through this.
And Senator, we're hearing from doctors right now, and they're still telling us that they don't have enough tests for all the patients who want them. So what is the federal government doing, and what should the government do to try to make sure more doctors can get those tests in their hands?
So what we need to do is ramp up the capabilities through the diagnostic tests, and those are ramping up through mostly the private sector as quickly as they possibly can, but it's also a supply issue. We've had a shortage of these swabs that are needed to actually take the test. And the fluid that it has to travel in. They've relaxed some of the requirements for that fluid so other substances can be used. And many hospitals are setting up drive-through entities, but we need to get those supplies out there so that they can relax the criteria of who gets to get a test, because it's still very constrained right now. So we're working with Governor Ducey's team to make sure we understand what the needs are in Arizona and engaging daily with federal officials for getting information out, and also with the private sector and the local hospitals. And we're also connecting constituents to where they need to go to get information.
Okay, Senator Martha McSally, we want to thank you for taking time to be with us this morning and keeping us up to speed on everything. Thank you so much.
Hey, thanks, Nick. We're all in this together. I just want to say, and people can help in other ways. Sometimes they feel helpless. They can donate blood, call the Red Cross, make an appointment, go volunteer at the food bank, get on your local social media and see if you can help some elderly and vulnerable in your neighborhood. This can really bring out the best in us, and our thoughts are with the healthcare workers who are on the front lines.
Okay, Senator Martha McSally, thank you for that, and also a good point for all of us to be taking action to help out our communities. Thank you, Senator. And
Great.
stay
Thanks,
with us.
Nick. Take care.
Thank you. Thank you. We appreciate it.